We've spent a lot of time in 2020 talking about death. We report death counts and try to compute the case fatality rate. But with so many challenges surrounding testing and diagnosis, how do we know the real impact of the pandemic? We can start by looking at the official numbers, the ones you probably see in the media. As of October 27th, there have been 1.17 million deaths attributed to COVID 19 across the world. Over 230,000 of those deaths have been recorded in the US. And if these numbers are true, it would place COVID 19 among the top causes of death worldwide, among road injuries and diabetes, and at number 3 in the US, only lower than heart disease and cancer. As a result, there have been two popular claims that have gone around on social media. The first was the 6% claim at the very end of August, which went that in the US, the real COVID 19 death toll is only 6% of the reported total. The death count is inflated, they claimed. This idea even got shared by prominent politicians. The error in this logic has been thoroughly explained by many, so you could check out Dr. Z-Dog's video, among others. The second claim passed around in certain online groups was that the number of deaths we're seeing overall in the US in 2020 is completely normal compared to past years. I'll come back to this second claim in more detail, but in both cases, the claims go something like this: everything's normal, nothing to see here. Today, in our series Real Science Explained, we're going to consider whether either of these situations are possible by looking strictly at the numbers. We're going to look at what's called excess mortality. Throughout this video, I'll answer three questions. What is it? What does the data show in 2020? And what can we learn from it? So here we go. Before we begin, be sure to subscribe or check out some of the other videos on my channel. Also, let me know in the comments any questions you have. So what is excess mortality? Excess mortality is the number of deaths from all causes that are above and beyond what we would have expected to see under normal conditions. The formal term for total deaths is all-cause mortality. All-cause mortality just means total number of deaths by any cause. We don't have to classify or categorize deaths by their cause. It's just a total count of deaths. And when we say normal level, it means we are comparing against the average number of deaths, usually looking at the most recent 5 years. Deaths follow a cycle throughout the year. Each country will have its own pattern, but in the Northern Hemisphere, deaths generally peak in the early part of the year around January and February and bottom out in the Northern Hemisphere summer around August or September. When we see the number of deaths spike up above the normal range, it's usually caused by an acute event or crisis like a heat wave or an infectious disease outbreak. So, excess mortality is the difference between recorded deaths and the average number of deaths for that time period. If a country has, on average, in the past seen 50,000 deaths in the second week of February, for example, but instead saw 80,000 deaths during that week for this year, we would say the excess mortality was 30,000 for that week. Excess mortality doesn't tell you why anyone is dying, and that's actually why it's so helpful. It doesn't depend on testing, a doctor or coroner's determination of the cause of death. It's an unbiased statistic. So what does the excess mortality data look like in 2020? The first thing we have to know is that excess mortality data isn't available in every country. To compute excess mortality, you have to have up-to-date and complete reporting of deaths, which is just not possible for many parts of the world. But for much of Europe, North America, and South America, as well as particular cities such as Jakarta or Mumbai, we have data. Many different organizations have been compiling this data, including the New York Times, the Financial Times, and The Economist. If we look at the coverage provided by the New York Times data, we see that we have mortality data for 19% of the world's population. That is, we can only compute excess mortality for about a fifth of the world. Yet, just in that subset of the world, we have seen more than 1 million excess deaths as of October. From January to September of 2020, 1 million people died, more than normally die, during that period. Now, each year, normally around 60 million people would die around the world. As just a rough approximation, let's say that January to September is 9 months, so that's 9 over 12 or 75% of the year. So we would normally expect 45 million deaths globally over that 9-month period. However, remember, we're only looking at data that represents 19% of the world's population here, so that might be about 8.5 million deaths. That's roughly what we would expect to see in those places over that time period. So 1 million extra deaths is a 12% increase from normal. This is not insignificant. And these excess deaths are not evenly distributed around the world. In much of North and South America, deaths have exceeded normal levels throughout the entire pandemic and have not returned to normal levels. Brazil, Mexico, and Peru, for example, have had deaths 19, 61, and 141% higher than normal, and excess mortality has been observed all year. Many countries in Europe, however, experienced a spike in excess mortality in March and April, and then deaths have returned to normal in the summer months. In some countries, including Iceland, South Korea, and Thailand, they have not observed any excess mortality at all. And finally, we come to the US. The number of deaths in the US has consistently been high, much higher than in the previous 5 years, with this trend starting in March 2020. Currently, the US is on track to record at least 300,000 extra deaths compared to a normal year. So that brings us back to the two claims made on social media that I mentioned at the beginning of this video. When we considered excess mortality, we don't have to decide whether the death was correctly classified as a COVID-19 related death. But what about that second claim, that the number of deaths in the US is normal? This was a so-called Q alert, and I must tell you, it's very clever. The claim uses very real data from the CDC and even provided links to the CDC website. What we see is that according to this post, 2.13 million people died from January to the end of September, which is 236,000 per month. And if we extend that average for the remaining 3 months of the year, it adds up to 2.84 million for the total, which is squarely in line with the totals for the previous 3 years. Hence, no excess mortality in 2020. But what this Q alert hoped is that you would not actually go to the links and download the data yourself or bother to try to understand how this data is collected. If you do that, like I did, you will find that the 2.13 million deaths recorded up until the end of September is not complete data. It's what's called a provisional death count. Because the CDC does not actually collect death data itself, it only compiles data sent to it by local and state governments. It takes weeks and even months for all the data to come in. In fact, if you look at the provisional death data, you see a sharp drop-off in the number of deaths recorded in September. In that last week of September, you see only about 16,000 deaths. In fact, this is maybe only 30% of what the final total will be for that week once all the data has arrived. This delay in data reporting is why the CDC does not report final mortality data until a full year later. Incredibly, this incomplete data nicely balances out all of the excess deaths recorded earlier in the year to allow this Q alert to convince many people that things are totally normal this year. And so there is no question, the US and many other places around the world are experiencing extremely high excess mortality. And so that leads us to the final question. What can we learn from excess mortality data? I think there are two things we can take away from this data. First, COVID-19 death counts are incomplete and not comparable. The COVID-19 death reports, which we often see in the headlines, are a reflection of testing and reporting policies and often cannot be compared across different countries or even states. Each country may have different capacity for testing, different strategies for surveillance, and different specifications for attributing deaths to COVID-19. What we see in this data is that among the 19% of the world for which we have the data, excess mortality shows over 350,000 more deaths than are reflected in the official COVID-19 death count. In some places, like Belgium, the official COVID-19 death count is nearly identical to the excess mortality. In other places, like Mexico, excess mortality is way higher than the official COVID-19 death count. Unlike COVID-19 death counts, estimating excess all-cause mortality using a standard approach across countries provides a powerful tool to rapidly obtain unbiased estimates of the COVID-19 mortality burden. The second takeaway is that excess mortality allows us to capture the total impact of the pandemic. Excess mortality is a more comprehensive measure of the total impact of the pandemic on deaths than the confirmed COVID-19 death count alone. In addition to the confirmed deaths, excess mortality captures COVID-19 deaths that may have been directly caused by COVID-19 but were not correctly diagnosed and reported, as well as indirect deaths from other causes that are attributable to the overall crisis conditions, such as missed treatment. When we bring all this together, we realize that determining the cause of death is complex. Often, someone's death is the result of multiple failures and simultaneous health problems. But when we stop arguing over what caused the death and just consider the raw numbers, we're able to see that 2020 has seen a lot more death than usual. In time, we will be able to put together a clearer picture of the total global burden, but what the data shows us so far is that undoubtedly the COVID-19 death totals still don't capture the full impact this pandemic has had on the world. Thanks for watching, and we'll see you again next time.